Introduce now the Michael Leach. He is the state director for the South Carolina Department of Social Services. Michael has extensive experience in child and adolescent needs, child welfare, and crisis response services. Michael, how are you?
I'm doing well. How are you, Congressman Lawrence?
Fine. Thank you so much for taking the time. Well, let's just get right into it for the next 15, 18 minutes that we have. South Carolina's Department of Social Services has a lot of responsibility from the prevention of abuse, helping victims. You guys deal with child support, the SNAP, the supplemental nutrition programs, adoption, foster care, and really everything in between. How has the department's role changed in light of the COVID-19 crisis?
Yeah, great question. There's no manual for how to deal with a pandemic like we are currently experiencing. In the wake of COVID-19, we've had to continue to take steps to continue our critical missions of providing food, financial assistance, and promoting the safety of children and vulnerable adults in South Carolina. We are focused on continuing operations and our essential priority business functions. We are seeing delays in some services and response times due to the ever-changing situation, especially in SNAP. One example is a supplemental nutrition assistance program. You know, in your 5th congressional counties alone, Congressman, our workload doubled in SNAP from March to February, and that puts a lot of stress on the current staff that are affected by this as well. We've also had to deal with a lot of stuff on the recent tornadoes and storm damage. We are short-staffed across all program areas, and I've seen a lot of teams step up. But we have to continue to focus on strengthening families, and but this can be difficult to maintain when we have to be concerned about keeping ourselves and our families healthy as well.
For our listeners, run down just a few of the additional roles that your agency is now taking on as a result of the COVID-19?
Yeah, so the governor's orders requiring only essential employees to report to the office has changed some ways we do business. We've had about 85% of our workforce working from home. We have about 700 individuals who continue to work at offices across the state, including the counties that are part of your district. We have had employees who have had confirmed COVID diagnoses, and we've had to put policies and practices in place to deal with that, cleaning of offices, and making sure that we're keeping our staff safe and socially distanced as much as possible, and keeping the work going. We've also had to adjust to a lot of visits with families and other constituents through the use of FaceTime or Skype to make sure that everybody is safe.
And you had brought up SNAP, and now that the pandemic has caused more and more people to be out of work, and for our listeners, the month April 25th ending then, we had 65,000 people file claims in South Carolina. What does this mean, Michael, for those that have apply online or apply for applications for the SNAP program?
Yeah, we knew when we started seeing the increase in unemployment and the stressors that are coming with this pandemic that we would probably see an increased need for SNAP. In the month of March, we issued benefits to 11,800 new cases, not existing clients, and we've issued supplements for current clients to increase. So we've increased the amount of money that we would provide families that are current SNAP recipients, and then we've also been getting a lot of new clients due to obviously current stressors during the pandemic. We've issued close to $97 million in SNAP benefits to all clients during the month of March, which is compared to an average of $67 million in paid to clients in the month of January and February. Again, more new clients and then increased amounts so that people can can manage and take care of their families and provide food assistance to them. We processed 44,000 applications during the month of March, and that's about a 150% increase. Again, a lot of need, and we're trying to make sure that we get these done as quickly as possible.
Let's address something that nobody likes to talk about, but it's child abuse. And I know that you're having fewer reports of child abuse, but really that's not the whole story. It seemed like it'd be a good thing, less people report it, but walk me through what's really going on now that more people are staying in.
Yeah, so our abuse and neglect and vulnerable adult abuse intake call centers are operating normally. But as of the last week of April, we saw a 46% decrease in our reports received for child abuse and 14% decrease in our vulnerable adult abuse that's received. This is compared to about a year ago at this time. We know that parental stress and financial instability and isolation and lack of resources are factors for child abuse and neglect. And those risk factors are heightened during this current pandemic. So we also know that a decrease in referrals at this time does not mean there was a decrease in abuse and neglect, but rather a side effect of having fewer external eyes on children during this time. So teachers, kids being in school at this time or being in child care settings, those committed, caring, loving adults who are taking care of those folks every day aren't seeing them every day. And that's some reason for some of the decrease. We're trying to make sure that we message this through social media accounts and through our partners, Department of Education and Department of Mental Health, and to advise the community that if you witness or suspect abuse or neglect or the safety or well-being of children or vulnerable adults, that you call our hotline at 1-888-227-3487.
Great. What and how's the state doing, and what's DSS doing specifically to combat this abuse of children and vulnerable adults, many who have infirmities that can't protect themselves?
Yeah, again, we've had to change a lot of things. Abuse is still occurring, although it may not be currently reported through traditional routes. Again, we believe that the less eyes with our educational professionals, guidance counselors, mandated reporters, affect this. We do see drops in reporting or calls during the summer months. Nationwide, that's a normal trend that you always see. But that's normal. We expect that. Families are expecting that, and there's still routines that go on. This has been a shift in everybody's routine, and they've had to adjust, and the stressors are more high. We have parents who are teaching, these days. But we continue to still do investigations. So if a call comes in and it is screened into our hotline, our staff are still going out and doing investigations face-to-face to make sure that children and families are safe, and adults.
And Michael, if somebody's listening to the program this morning and you suspect that the abuse of a child or a vulnerable adult's taking place, how should they go about it? Should they start with the local law enforcement? What would you recommend as a 1, 2, 3 stair step to report this?
Yeah, I do think if they feel like there is an urgent safety need for a child or an adult, call 911 for sure. If there is a suspicion of abuse and neglect, they can call our hotline number at 888-227-3427, and our staff, our Adult Protective Services staff or our Child Protective Services staff will go out and investigate and coordinate with law enforcement when appropriate. Law enforcement and our CPS folks and APS folks work closely together, going out on investigations and working together to make sure that we're all on the same page.
I tell you, law enforcement, there's not a more caring group of people than law enforcement, particularly when it comes to abuse of any kind. And we'll put all this information up on my website, norman.house.gov, and so that people know exactly where to go. Now, on positive news, child support payments are an area of focus for the DSS. In March, the CARES Act provided for economic stimulus payments for most Americans. And the federal government had some rules about garnishing those payments from folks who have past due child support. Talk about the details of that, if you could, for a moment.
Yeah, so I think many of us are aware of Congress passed and President Trump signed the CARES Act, the Coronavirus Aid, Relief, and Economic Security Act. It in part provides individuals with rebates of up to $1,200 or $2,400 if married and filing jointly, plus up to $500 for each qualifying child. The IRS and the Bureau of Fiscal Service of the Department of Treasury are preparing to process, these rebates in the form of economic impact payments in the coming days. Many of us already have them, and some people are still getting those. We still at DSS have to consider child support in those stimulus checks and what that looks like. So the federal government gave guidance that there is no exemption for child support debt. So as a result, the impact payments that someone may get or made eligible to non-custodial parents who owe past due child support and who are subject to intercept under the income tax refund offset program will be offset by the amount of past due child support. So what that's saying is that a custodial parent still potentially will get access to those payments if there are past due child support. It's a balance with child support because we want to make sure that families are getting the child support they deserve to take care of their family and the child. But we also, in this time of COVID, want to make sure that our non-custodial caregivers and parents aren't going through more barriers and difficulty as they're also trying to survive as well.
Well, one thing the CARES Act did was to provide grant opportunities for child care providers. Tell our listeners what some of these grants are for, who's eligible to apply, and how this really helps the child care providers and those that rely on these services.
Oh, sure. Yeah. So there are 2,419 regulated child care facilities in South Carolina. This includes centers, churches, and family homes. Our site, we have a site, scchildcare.org, is a great resource for both child care providers and parents. We did get funding through the CARES Act for child care in the state of South Carolina, as did every state in the nation. As part of the funding, and we just received it recently, we are offering child care assistance for parents that work in businesses that have been deemed essential during the COVID-19 pandemic. Folks that are having to respond to COVID, making sure that we assist them with child care and paying for some of that. So in order to qualify, you have to be currently working in an essential business. You must need child care, so you have to continue to work and continue to and complete a child care application. You do not have to meet any income guidelines, and more information is on our DSS website and the scchildcare.org website. We've received close to 3,000 requests. We are working as quickly as possible through these requests and have approved approximately about $3.6 million in vouchers for about 900 children across the state.
Let me add for our listeners, don't give up. If you think you may be eligible or want to think about applying and don't have a way or don't feel like you can actually do that, call on our office at norman.house.gov or call us. We will walk you through the process. This is a great program to to be aware of. Challenges that I guess are unique now, Michael, that you can just touch on?
Yeah. A couple other things real quick is that we also are applying childcare grants for cleaning and sanitation for childcare centers. And coming soon, we're also working on other grants to childcare providers to ensure they're able to remain open or reopen quickly and safely. We obviously have to put a process in place, and we want to do it as quickly as possible to make sure we can get this money out to the childcare centers so that will help them. Challenges facing, DSS and childcare facilities and everything else is that, we continue to try to communicate with all our constituencies, our group homes, our childcare providers, foster homes, families that we work with. We serve 1 in 6 citizens in South Carolina. And so trying to make sure that we continue communication, we update them with the best, most recent information to help them make decisions in regards to whether they continue to operate, how they support children and families. So that's been a challenge, making sure that we keep, because the information is coming so quick, and things are changing on a daily that it is hard to keep people updated. And this includes our own staff, making sure that they understand what's going on with this. And the biggest thing is making sure people have the facts so that we can, make sure that we ease anxiety and fears about all of this, and make sure people are safe, but also keep things moving to strengthen families.
Well, we appreciate what you're doing. The whole response that we've seen has been phenomenal. But the best description I heard was it's like building an airplane while you're taking off, and that's what many of the agencies have felt, and that's what I know those of us in the political arena have seen. Touch just briefly on the preschool development block grant. What's happening on this front?
Yeah, so DSS has been able to engage our federal partners at the Health and Human Services at the federal level and the Administration of Children and Families in the Office of Child Care, and we have some good news. We got an $11 million a year preschool development grant that has been renewed. We've had it, but it was renewed, and we continue to work with early childhood partners to serve our state's youngest citizens. So the grant is birthed through 5, and it's made possible through funds through Congress added to the 2020 spending bill. The initial funds, PDG funds, were used to develop a statewide early childhood needs assessment, strategic plan, and a web portal to help parents of young children access early learning programs. And so we will continue to figure out what we need now for our partners and our families to make sure that we're connecting to quality child care. And I want to thank our DSS Child Care Division for advocating for South Carolina's children and families and remaining diligent in this difficult time to get this money. So this is great for the state of South Carolina, and thank you, Congressman Norman, and your colleagues for supporting the preschool development funding.
Well, it's an honor to do, and I just want to thank you for your service as director of DSS. How's your staff doing physically and emotionally?
Thank you for asking that question. I want to thank our 4,300 DSS professionals for their continued dedication, passion, enthusiasm for what they do. We have professionals across the state who are working nonstop to help get food benefits to feed families because we know more people are in need. We've seen increased call volumes, putting more pressure on our team members. We have staff working to make sure families continue to receive the needed child support payments. We have staff working to set up temporary child care centers and others who are providing needed support to those child care centers who are still remaining open. We have professionals who are putting themselves in harm's way in order to fill responsibilities for investigations around abuse and neglect. Our staff are worried about their health and their families while trying to make sure others are safe and fed. And our staff are acting in roles very similar to first responders at times. People don't think of our staff in that way, but, social workers and people who work in our field are givers. They go to work and deal with extremely difficult situations and frequently have to sacrifice time with their families and friends to care for others, but aren't often given prestige for this important work. They're anxious and afraid like everybody else, and they're continuing to get this job done so that the citizens of South Carolina have what they need.
Well, Michael Leach, I just want to thank you. You're head of DSS. For our listeners who tuned in late, thank you for your service, and we really appreciate you taking the time to come on the air and inform our listeners about what's going on with